Good morning. Today is Saturday, January 14th, 2023. Just let me check the setup because last Saturday the Facebook was testing our patience and okay, it's looking good. We have no technical problem. As I said, last Saturday Facebook was testing with a 3 internet interruption. So this is the beginning of the year 2023. This is our regular Saturday morning yoga therapy classes, which we used to have in live, and after pandemic we switched to virtual. So beginning of the year, everybody asks how to start. How to start. It's a yoga therapy. Today's topic is yoga therapy, how to start an asana practice. Now, very, very important. In a yoga therapy, in therapeutic yoga, asana practice is primarily for musculoskeletal disorders. Musculoskeletal disorder means back pain, knee pain, hip pain, neck pain, shoulder pain, all the aches and pains of our body. But it's also a profound relaxation response, activation of parasympathetic tone, and preparing our body and mind for pranayama and then to meditation. Now, let's talk about a yoga therapy for a particular disease condition in our musculoskeletal system. Now, as you know, yoga is a union of your body, mind and spirit. It's a philosophy, 196 sutras called aphorisms, of which 193 is to quiet down your mind. Practice is 8 limbs: Yam, Niyam, Asana, Pranayam, Pratyahar, Dharan, Dhyan, Samadhi. 8 limbs in Sanskrit, which is corresponding English word. It starts a practice and leads you to the union of your body, mind and spirit. Now, the first yogic principle. Yoga therapy is not a reductionist like a Western medicine. What is a reductionist means, in Western medicine, I have a right knee problem, my orthopedic surgeon, my physical therapy will be working on my right knee. In yoga therapy is completely opposite. Yoga therapy is a holistic approach. Holistic approach means you take care of the whole body. According to yoga principle, every part of your body is connected. Our neck is connected to our feet. Our knee is connected to our shoulder. Shoulder may be connected to our back. So there is no reductionist approach. But also, we also have one term called reductionist holism. Reductionist holism means after you take care of your body as a whole, then you have particular yoga therapy, asanas, pranayamas, meditation for particular disease condition. For example, I have a neck pain. Initially, I have to take care of my whole body, and I will show you how to take care of the whole body. Then we do specific therapy for the neck, like prayer pose to the back, Paschim Namaskar. Then movement of the neck is called Brahma Mudra, and we'll go ahead and show it to you. Same way we have a yoga therapy for your shoulder pain, knee pain, hip pain, but this is after your holistic approach. Second concept, yoga therapy provides you with a health. Initially, it has two components. First component is called Roger Chikitsha, treatment of a disease, and then it's called the Shastharokha, maintenance of your health. These Shastharokha, maintenance of your health, does a transformative changes in your body. Yoga therapy is called the art of transformation. What is wonderful about yoga as a therapy is, if you practice a asana, pranayama, meditation, or any of the 8 limbs of the yoga, you are going to have some benefit. You will see immediate benefit. But that immediate benefit is not long lasting, and the immediate benefit is not transformative. Transformation means you don't come back. Transformation means a caterpillar turns into a butterfly. The butterfly can never be a caterpillar. So your body, once it is trained and you are going to do a daily practices, it's never going to go back where it came from. It is called the default mode network. Body takes you to the default mode, that means where it came from. It activates your homeostasis, or we call homeokinetics. Now, in yoga and Ayurveda, the health is defined as a balance of body, mind, and spirit. So balancing is most important. Then the component is Merudanda Achal and Manasthir. Merudanda Achal means you keep your spine straight all the time, quiet down your mind. Then the other concept of health is a strong digestion, easy elimination, and good night's sleep. We learned it from our babies. A healthy baby eat, poop, and sleep. As simple as it is. We have asana practice for proper elimination, proper digestion, and proper sleep. So go with these asana practices today, and also we'll start with the first principle. Is called keeping your spine straight. So here I am. I'm sitting on a special stool called a kneeling stool. All of you have seen, and I've shown it to maybe 100 times, what is a kneeling stool looks like. This is the kneeling stool. And a kneeling stool, you sit down with your knees in front, and when you sit down, then what you see there is that your spine is straight and always stays in this state of straight spine. My keyboard is in this level. My screen is here. And when I'm working in my computer, I'm totally always, my spine is straight. I have my desk, which is your adjustable or moving desk. Desk can go up and down, and based on my level, keep it. So this is a daily practice, and you also keep your body straight. Same thing, if you sit in a chair, same thing you will be doing it. If you sit in a chair, you will sit down with your spine straight, feet touching the ground. If you go all the way to the back, you'll keep your spine straight. As simple as it is. And this is your 24/7. This is embedded in your mind to always keep your spine straight. The moment you keep your spine straight, you will be seeing your knee pain will go away, your hip pain will go away. It's an amazing principle of yoga that we follow it every single day. So, first thing, when you get up in the morning, what we do for our health and proper elimination, we sit down in a squatting pose and you drink at least 2 or 3 glasses of water in a room temperature. In yogic principle, they drink from a copper vessel, and we keep the water in our nightstand and we drink it. When you drink it, we drink in a gulp. And I'm going to show it to you when I start sitting down. And when you do it in the squatting pose, you have a sensation for a bowel movement and hit a proper bowel movement. Next, keep our spine straight. When you're getting up from the sleep, all the muscles are relaxed, because in the sleep, all of your muscles get relaxed and your body core temperature comes down. So when you get up, your body tightens up. So think about it. My skeleton is going to fall in the front because my head is very heavy. So to keep my body straight, all the muscles of my back, called paraspinal muscle, contracts to keep me straight high up. So if I keep myself, the spine straight, the muscles on the side of space gets relaxed. Initially it feels like a 2 stones sitting here. Now it will feel like, 2 pillows sitting there. So what do we do in the first thing in the morning? We'll go against the wall. It is called keeping your spine straight against the wall. Literally, if you think about it, it is like a savasana against the wall. So here I am against the wall. This picture is against the wall. I will put both of my feet together. My ankle is touching the back wall. Then my hip is touching the wall. My shoulder is touching the wall. My head is touching the wall. And what I do, I keep my eyes closed. Then I bring the relaxation. The relaxation comes with the exhalation. Exhalation is parasympathetic. Inhalation is sympathetic. Lung is like a balloon. It has 6-liter capacity and needs 1.5 liter to stay open, with 4.5 liters to exchange. Close my eyes. I bring my attention to my lung. First I breathe out. Then I slowly take a deep breath in without any effort. Then I breathe out longer than breathing in. For the practice, I will do between 5 to 10 breaths, but I'm showing it to you because of the time frame. Just take a slow deep breath in. Breathe out longer than breathing in. If you can get 2 seconds in, try to get 4 seconds out. 3 seconds in, 6 seconds out. But make it completely effortlessly and start where you are. Don't push yourself. We do all these things with a health tracker. You have an Apple Watch here, and I can see. Next, I'll slowly get my hands high up and touching the wall. I'm straighten my spine. Eyes are closed. I'm breathing out normal than breathing in. I can clearly feel my body's muscles are slowly getting in relaxation. Initially, muscle contracts to put me in an asana pose. Muscle cannot stay contracted that long. Slowly, muscle starts to relax. Before relaxation, it causes some fasciculation, get some twitching. Then you get a profound relaxation. 3 stages of asanas called the arambha, beginning. Then is sthiti, your stability, the twitching is gone. And then your what happened? I lost my okay, I'm back. Something happened again, you know. So arambha, sthiti and visarjana. So hands are high up, you are completely relaxed, you are breathing out longer than breathing in, then put your hands in the top, keep your elbows touching the back wall. Eyes closed because your mind is the content of your 5 senses. I hear, I see, I smell, I taste and I touch. Same way, I'll stay here between 5 to 10 breaths. Next, once I keep my body straight high up, I'll slowly get down into a squatting pose and I will get up without a support. Getting up from sitting down posture is called a sit rise test, and it is a pure function of your health. If you can go all the way down to the ground and get up without a support, you are 100% healthy. There's a lot of studies done. There's a cardiologist in Brazil that are 3,000 people, and if you put one hand, you lose your 25%. Use 2 hands, lose 50%. 3 hands, not 3 hands, 2 hands and then your feet. Now let's see what we need to do to improve our proper elimination. So you will sit down in a excuse me. As I said, you will slowly get down from standing up. Feet, you slowly get down into your malasana or squatting pose. Initially, you will have a problem to get into malasana. What you can do, you can get a slowly in stages. As I said, stages, impossible become possible. If you get up, if you're here, stay here. If you stay here, keep your eyes closed. Do breathing out longer than breathing in. Slowly and slowly, neuroplasticity will set in and you will be able to come to this posture. When I'm able to sit down in this posture, I hold a glass of water and I start drinking. I start drinking in a gulp, one gulp at a time, and the gulp helps stimulating your peristalsis. Then the water goes to your stomach. It creates a reflex called a gastrocolic reflex. Gastrocolic reflex means when your stomach stretches, it contracts your colon. When it contracts your colon and in this position, your junction of the anus and the rectum, called anorectal junction, becomes straight. Normally there is a kink to prevent any incontinence. And in this posture, your pelvic floor muscle relaxes. So you get a proper urge for a bowel movement. May not take initially in one day, but if you keep on doing it, neuroplasticity will set in and you will see it happens every single time. Our Western commodes are not suitable for proper bowel movement, so we use one what is called a squatty potty. I have the squatty potty in every bathroom, and you probably have seen. I put a squatty potty next to my commode, sit down, squatty potty, I get a proper bowel movement. Once you have the first bowel movement in the morning, you are healthy. Carrying that dirty stool in your colon throughout the whole day is going to hurt you. Next, relax your hands. Say, I have a neck pain, but I'm doing this thing to holistic approach to my whole body and mind, improve my health before I come doing the particular reductionist holism or holism reductionist for my neck or my shoulder or my knee pain. You put your hands together, and if you do like a baby called baby fist, Balo Mushti Mudra, take the thumb inside and close. If you do the thumb inside and close, and if you do with the breathing, breathe in, breathe out. Your hands will get relaxed. All the pains and aches in the hands will go away. All the pain comes from the tightness. Pain doesn't come from that inflammation. Pain doesn't come from rubbing to the cartilage to cartilage, because cartilage has no pain fiber. Body tries to splint it. Body tries to tighten up the ligament and the muscles. And once you're relaxed, you will have a parasympathetic activation. Now here I am. I'm talking to you for so long. My mouth is completely wet. The mouth is full of saliva. That means I'm having parasympathetic activation to the saliva in my mouth. From mouth to the anal canal, the whole gastrointestinal tract is supplied by parasympathetic nerve. When your hands are relaxed, your fingers will go in, hands will turn around. So if you put your hands, separate your fingers, hands will get relaxed. Wrist will get relaxed with your extension, and you can put your one elbow inside, other elbow inside. Slowly bring your hand close to you. Keep your spine straight. Close your eyes. Breathe out longer than breathing in. We say it's going to be a money back guarantee. You are going to restore your health. No disease will dare to come close to you. This is such a powerful yoga therapy technique. Proper elimination and proper relaxation response and activation of parasympathetic tone. Beginning of asana practice. Next, proper digestion. Proper digestion is totally based on your parasympathetic activation, because your mouth to the toe is supplied by parasympathetic nerve. We can activate parasympathetic nerve with the multiple phenomena. We do it through pranayama, but for the asana, most relaxing asana for proper digestion is your Vajrasana, thunderbolt. We as the yogis, and we have seen our parents, even our grandparents, they always sit down in a Vajrasana, thunderbolt position after eating the main meal. Every yoga asana we practice in an empty stomach. And Vajrasana we practice after full stomach. In a Vajrasana, you slowly try to sit down in your ankle first. In stages it will happen. Keep your spine straight. What it does, it keeps your spine straight, keep your head high up. Slowly, I will show it to you in stages. You can put your feet on the ground, and this will affect your ankle. So what you can do, if you get a small, or you can roll up your yoga mat, or you can get a small, I have this one small pillow. This is the only thing I have here, so I can put it under my ankles and I'm able to sit down properly. Sit a little inside. Yeah, here it is. Perfect posture for your Vajrasana. Stay in the Vajrasana, it will improve your digestive function, because this is a profound relaxation and activation of your proper parasympathetic tone. If you have a problem sitting down, then what you can do, you can take not a pillow. The best thing for you to use is a folded blanket. In a folded blanket, what you can do, you can put the folded blanket here and you can sit down, and slowly you can take out the layers of the folded blanket. Once you're comfortable in this Vajrasana, then what you do, you go into an asana called your Mundukasana. Mundukasana, you take your hands, put your hands in a called Adhi Mudra or Balu Mushti Mudra. So you'll be able to see what I'm doing. This is a Vajrasana. This is to improve your digestion. Basically, we call it a digestive fire. Improve your digestive fire. So what are the steps? We kept our spine straight. We put our body against the wall with the hands high up and putting the hands over the head, keeping your body straight, able to sit down in a squatting position called Malasana, able to relax our whole body. Vajrasana, hands in a Balu Mushti Mudra, thumb inside and close, put your hands at the level of your belly button, keep your spine straight, look straight, breathe out first, take a deep breath in and slowly keep coming down. Remember two concepts, no pain. If you get a pain, you back off. But you back off, but you stay where you are, close your eyes, keep breathing, your body will slowly come down. Second, follow your breath. If your breath is effortless, keep coming down, and essentially you will be able to touch your head to the ground. Try to keep your back in proper place. Stay here. Breathing out longer than breathing in, between 5 to 10 breaths. A powerful stimulation to your digestive fire. Jathar Agni. Next is your good night's sleep. Remember, we are starting how to start an asana practice. Asana for keeping your spine straight. Asanas to quiet down your mind. Asanas for proper elimination. Asanas for proper digestion. Asanas to proper sleep. Before we go to the sleep, we want to show it to you how to activate the neuroplasticity. Remember, neuroplasticity basically means habit forming. And also, you will be able to do all this sitting in a chair. So look at the principle of how to start an asana practice. Today, I'm not going to show the disease-specific asanas. That we'll do later on another time. We'll do one day, say, yoga practice for your neck pain, yoga practice for your shoulder, yoga practice for knee pain, hip pain. We'll do all these asanas, pranayamas, meditation. So, how to start a proper asana practice? Two components. You have to listen to your body signal. First, body signal is no pain. If you able to sit down in a posture without pain, you start from there. Second, you start where you are. You don't compete with anybody. You practice with your eyes closed, so you really don't see who is doing what. If you are not able to sit down in the ground, practice it in a chair. It's good enough. First asana, if you're able to sit down, is your called Sukhasana, easy pose. What is a Sukhasana? Take your one foot, put it under your knees, take the other foot under your knees, keep cross-legged, your spine straight, and able to sit down in a yogic asana called STHIRAM SUKHAM Asana. Sthiram is a stillness, Sukham is the happiness, asana is a pose. What are the two body sensation you are going to look at? Number one is your pain. So put down here, you are feeling pain. What you do, back off. You back off to a position where you don't have any pain. Second, you look for your breath. Your breath has to be completely effortless. So when you get an effortless breathing, what does it mean? It is a yogic phenomena called Annamaya Kosha to Pranamaya Kosha. That means any imbalance you create in your physical body, it shows up in your breath. That imbalance may not even be your musculoskeletal. Could be your raise in your blood pressure, raise in your intraocular pressure, raise in intracranial pressure. It will all shows up in your breath. Somebody sitting in front of me, I take a look at his or her breath, and I can clearly distinct what the person is going through. So the quieting down your mind, as I said, the mind is the content of your five senses. I hear, I see, I smell, I taste, and I touch. And most powerful of all the senses is my vision. Eye is the extension of your brain. Eye is the direct connection to the brain with a big nerve called optic nerve. Eye is also supplied by another 4-5 cranial nerves. Two muscles in the eye, we call it SO4, LR6. Superior oblique is supplied by 4th cranial nerve, LR6. Lateral rectus muscle supplied by 6th cranial nerve. Trigeminal nerve, the 5th nerve, it supplies branches to the eyes, and the optic nerve takes the retinal impression to the brain. Close your eyes. Keep your spine straight. Close your eyes. Then the mind is connected to your hand. We use our hand before you can even speak. If I like something, I will say this. If I want something, I say this before I say, give it to me. So the hand that is called the mudras, called hand gestures, is called health in your hand. We will do another session again this year, which called your health in your hand, the therapeutic function of the hasta mudra, means hand gestures. Touch your index finger and thumb. There is a very fine concept. Our body and the universe is made of 5 elements called Pancha Mahabhuta: space, air, fire, water, earth. Akash, Jal, Agni, Akash, Vayu, Agni, Jal, Prithvi. This is space, this is air, this is fire, this is water, this is earth. Touch your index finger and thumb. Jnana mudra, Dhyana mudra, quiets down your mind. Put it over your knees, eyes closed, and I told you before, you bring the relaxing power of breath. Every asana practice, you breathe out first. Take a slow, deep breath in without any effort. And breathe out longer than breathing in. You will be easily able to do count of 2 in, count of 4 out. Like this, count of 2 in. Count of 4 out. 1 and 2 and a 3 and a 4. If you keep on doing for a while, your neuroplasticity will set in, which will be habit forming. You'll be able to do it a little more. You'll be able to do 3 seconds in, 6 seconds out. We've been doing so long, let me show it to you. Count of 4 in, count of 8 out. Breathe out first. Count of 4 in. Count of 8 out. This has become very easy for us because we've been doing it for a long time. We can easily do count of 10 in, count of 20 out. Let me show it to you. Count of 8 in, count of 16 out. I'll be doing it in silence without any talk. Breathe out first. This was 8 seconds in, 16 seconds out. In a therapeutic pranayama, improving the voluntary restrained breathing and improving your lung function. The most important component is able to slow down your breath and able to take a larger amount of air in and out. So think about it. Normally our breathing rate is 15 to 16 per minute. The moment we do it, count of 2 in and count of 4 out, that means it is 6 seconds, your rate is already down to 10. We are easily doing count of 4 in, count of 8 out. 12 seconds. You reduce it to number 5. We can do count of 8 in, count of 16 out. 24 seconds the cycle. Just about 2.5, just 3 breaths per minute. And we'll be able to breathe like this even when we're sleeping. A profound relaxation will come in, and slowly this asana will take you to a state of pranayama and then to your meditation. This asana STHIRAM SUKHAM ASANAM, stillness, happiness asana, will take you to your meditation. Meditation is quieting down your mind. It is not a thoughtless mind. Our mind has a multiple thousands and thousands of thought process. In meditation, you enter in between the thought process. Slowly take out the repeat thought process and quieting down your mind. The mind, which was like a Niagara Falls, became like a river and almost defined like a pond. Then when you are comfortable in this position, yoga said health is a balance of your body, mind and spirit. We are in proper imbalance because either I'm right-handed or left-handed. Right-handed, I'm using everything with my right hand. Learn how to use your left hand. Start brushing with your left hand. Try to do everything with your left hand. Wipe your table with your left hand, always functioning. Try to stand on your left leg. So in this position, what we do now, we take our foot, cross our foot in the opposite side. You will feel little discomfort in one side because you're not used to be balancing both sides of your brain. Do a little longer which side you feel discomfort, and then you'll be feeling better and better. For us, we feel equal on both sides. Then you do in stages and advance your asanas. You stay here, then you'll see able to do a little bit more. Same thing, if you do a prayer pose to the back, put your hand here, you stay here with your eyes closed, proper breathing out, longer than breathing in. Slowly your hands will get together. You'll be able to put your hands and you'll keep on going high up more and more. I'll show it to you. So the next one is called a Siddhasana, perfect pose. You take your ankle all the way to the back. Take the other foot on the top and your knees will drop down without any effort. If it stays up, let it stay up. Close your eyes, do your breathing, this thing will happen on its own. If you push it down, what will happen? It will come back higher. Stay here a little longer. Same frequency, same principle, no pain, effortless breathing, and able to stay here with stillness, happiness pose. STHIRAM SUKHAM ASANAM. Change your foot to the opposite side. Remember, always balanced. Every asana we do a balancing poses. Sukhasana, easy pose. Siddhasana, perfect pose. We stay here a little longer, but for the sake of little time, we can show you that from here we go to next asana. It's called Ardha Padmasana or Swastika Asana. Put your feet here, knees will be here, no pain. Breath has to be effortless. What is an effortless breath? Effortless breath is able to talk. You're able to sing. So I'm talking to you. I'm singing to you. That is my effortless breathing. If it causes pain, you back off. Even you can back off all the way down. Now, if you say it's hurting me, I'm not going to do it, you're not going to achieve anything. Oh, my knee is so bad, this knee is inflamed, knee is swollen, this is a cartilage to cartilage, I'm not going to do anything. Don't do anything. Keep taking pain medication, the day will come, you will get a total knee replacement, then you will see what happens to you. But if you give you this slowly in progression, yogic relaxation response, your pain is going to go away. Pain is not from touching cartilage to cartilage. Cartilage doesn't have any pain fiber. body tries to splint it. Tightness of the ligaments, tightness of the muscles. Once you learn how to be able to relax your ligaments and muscles, pain will go away. So, balancing. Other side, Ardha Padmasana, half lotus or swastika asana. See how slowly we are getting into your relaxation asanas. So, you are comfortable here, no pain, having effortless breathing. You take your other foot, slowly go high up, and this is called your lotus position or a Padmasana. Oh, looks like, my gosh, how can you do it? No, this is the most relaxing asana. You will never able to come here by force, be able to come with pushing yourself. It has to come on its own. And how do you test it? You can see your heart rate, or you can do EKG. See, if I do an EKG, which I can do it with this Apple Watch, I got a 30 seconds EKG and everything looks good. So it's very important. It's very important that you monitor your health parameters. So from here, what you can do, you can, sitting here, do a little prayer pose to the back. Paschim Namaskar. Remember, relaxation of this ankle, knee, hips, back is going to correct any musculoskeletal issue in your body. So, again, Western medicine is reductionist. It is to target the organ of pain or organ of your any illness, but yoga therapy is holistic. It's going to correct your whole body. So, one more thing I can show it to you. When you are so relaxed, you feel lightness in the body and mind. Put your hands on both sides, push your hand down, and body will go high up and stay high up. Tulasana. You'll stay in the Tulasana as long as you want. So I'm talking, I'm in Tulasana. I can stay here. Just to show it to you, then you can do a Bhunamaskar. You put your hands there, your head will come down all the way to the ground. Same way you will do other side, you will do the front, you will do all the balancing asanas. So the very important asana for your whole body and mind is your prayer pose to the back. Paschim Namaskar. Put your hand to the back, wherever it is. No pain, effortless breathing. So here it is. Close your eyes. Do breathing out longer than breathing in. And within a few weeks, with the proper input, your hands will become in a prayer pose. Stay in the posture longer and longer with your eyes closed, breathing out longer than breathing in, and your hands will slowly go high up. All the shoulder pain, neck pain, wrist pain, carpal tunnel, you name it, all the tightness of your body, all the pains and joints from your muscles and ligaments, in your fascia, all will going to go away. Because this is a holistic practice. We are not reductionists like Western medicine. So here I am, take a look. If I'm here a little longer, it will slowly go high up more. It will keep on going high up because more and more you relax, your shoulder joint and the neck will let you get in. Then you can do a neck. This is called your Brahma Mudra. There are 4 postures: front, side, back, and rotation. We do with your breathing. And I'll show it to you next time when we do yoga therapy for neck pain and shoulder pain. We'll end the session today with how you sleep. Because if you don't sleep well, you are not healthy. Again, health is strong digestion, easy elimination, and good night's sleep. Sleep is not how long you sleep. Sleep is how long you have a deep sleep. During deep sleep, you get the total rejuvenation and charging of your body. Sleep is like charging your cell phone. You need to charge your cell phone when you're going to bed. So, who sleeps well? 2 people sleeps well. First one is the babies, children, they very well. Next one is the yogis. So we learn how to sleep like a baby and a yogi, and we'll have absolutely no issue. The best position we have learned yoga is from the babies. The babies, even in the mother's womb, does yoga. Every posture they have, we did the ultrasound, we looked at the baby, all the postures are yoga postures. When you see the baby, baby will get up into a bhujangasana, cobra pose, get up into a downward facing dog. They will sleep like a called a supta baddha konasana. They will sleep like a called a fetal position, because that's a position they were in the mother's womb. Then we incorporate our breathing. So let me show it to you how we sleep, and you will be able to know. According to yogic principle, you go to bed by around 10 o'clock at night, drink a glass of water before going to bed, because at night you get an insensible perspiration. Your body loses moisture, which you don't feel, but it's going to wake you up. People say, if I drink a glass of water, I have to go to the bathroom. Yeah, drink a little less, so you have to go to the bathroom. After a few weeks, you increase a little bit amount of water, your body will get used to it. Slowly and slowly, you will be able to drink a whole glass of water without going to the bathroom. Wake up between 4 to 6 in the morning, 4 a.m. to 6 a.m. That's called a Brahma Muhurta. That is the time all the yogis wakes up. There are 2 kinds of sleep. One is called a REM, rapid eye movement sleep. In REM, mind is still very active. And I call non-REM. That's what a good sleep is. Non-REM has 4 stages. Stage 1, stage 2, stage 3, stage 4. Stage 1 and stage 2 about 50%, stage 3 and stage 4 about 50%. So normally it is at 25% of the REM sleep, 75% of the non-REM sleep. So look at a number. If you're sleeping for 6 hours, so your 25% will be 1.5 hours will be REM sleep, 4.5 hours will be non-REM sleep. Out of 4.5 hours, about 50% means 2 hours, 20, say 2.5 hours, you need to have a deep sleep. If you have a sleep tracker, you will be able to see the deep sleep. So it is not how long you have slept. You may have slept about 8 hours, 10 hours. And just for 1 hour of deep sleep, that is going to hurt you. You need over 2 hours of deep sleep. So first, we sleep like a baby. We sleep. I don't think you have seen how a baby sleeps. Let me show it to you so you will see how a baby sleeps. Baby will sleep when you put your head down. If you know, when you put your head, be sure your chin is below, chin is not high up. And if you need, you can put a little pillow to put your head in a comfortable position. Baby sleeps what is called your Supta Baddha Konasana. Close and they will take the feet, they will put the feet together and on the side. So start sleeping like this, like a baby. If you have a problem with the knees, you can put a couple of pillows here and that pillow will support you. And when you relax, it will slowly keep on coming down. Next we'll say a baby. Baby will close their hand in a fist, like a thumb inside and close. This is called a baby fist. Balu Mushti Mudra or Adhi Mudra. Third, baby will do abdominal breathing. You will say baby when it is relaxed. When a baby breathe in, abdominal wall will go high up. Breathe out, abdominal wall will go in. We are becoming like a baby. Breathe in, breathe out. Practice this about 15 to 20 times at the beginning of your sleep. Sleep has a lag time. You don't fall asleep less than 10 minutes. If you fall asleep less than 10 minutes, that means you are sleep deprived. If you can sleep after 30 minutes, you have insomnia. The sleep log is between 10 to 30 minutes. After you have done your abdominal breathing, now incorporate breath holding in your sleep cycle. You breathe out first, take a deep breath in, and you hold the breath at least twice the amount you breathe in. For example, I will breathe in a count of 4 in, and I'll hold the breath for count of 8. If I can do a count of 5 in, I'll hold a count of 10. I'll do it about maybe another 10 times. So give you 1 or 2 examples how to do it. Breathe out first. Breathe in with a count of 4 in. Hold your breath for count of 8. And breathe out. Try to also do count of 8 out. If you can do count of 5 in, you will hold it count of 10. Breathe out first. Breathe in for count of 5 in. Hold your breath for count of 10. Do it again about 5 to 10 times. The holding the breath increases the carbon dioxide level in your blood, which is called CO2 narcosis. It acts like a narcotic in your body. You can also practice the breath holding with a sequence 1 to 4 to 2. Like breathe in with a count of 4 in, hold the breath for count of 16, breathe out count of 8. And let me show you an example again. Normally my hand stays in like a Balu Mushti Mudra or baby fist. Here I'm going to show it to you. That's why one hand is up. Breathe out first. Breathe in with a count of 4 in. Hold your breath for count of 16. Breathe out with a count of 8 out. Very effortless for me because I've been doing it for a long time. So let me show you one more time with a count of 5 in. Ratio remains same, 1:4:2. Breathe out first. Count of 5 in. Hold your breath, count of 20. Breathe out to the count of 10 out. Perfect. Continue this for about 5 to 10 times. You'll find a proper relaxation. Then you sleep like a baby or sleep like a yogi. Yogis will sleep initially in a fetal position on the right side. They'll put the knees together in a fetal position. Generally, they don't have any pillow. They put the hands and they put the hands like a pillow. If you have a pillow, you can do it, or if you can keep it here, it's fine. Sleep is also a balance. During deep sleep, body inner core temperature comes down. And also your muscles can all relax. Initially, body's inner core temperature is high up. You sleep on the right side. Right side opens up your left nostril. Left nostril is cooling, called Chandra Vedi Pranayama. It brings your cooling energy. It tries to balance the high inner core temperature of the body. After a while, the yogis will sleep on their left side. That's the side they sleep for whole night. So they'll come back to again in a fetal position. You can put your head on the side, or you can put your hands like this. Okay, I can do it here, or if you can take a pillow small pillow, because this is your whole night's sleep. You don't want to be comfortable too. Hands here. This is the way you sleep for the whole night. Now, during a deep sleep, body core temperature is coming down. Right nostril breathing is called a suranari, sun energy, and it's heating. So the heating energy going inside your body is balancing the cold temperature inside our body. Next, the main blood vessel which carries all the blood to our heart is called inferior vena cava, which is a low pressure system. It's on the right side. Left side you have a main blood vessel called aorta, right side is inferior vena cava. Sleeping on the left side, you took away the pressure from the inferior vena cava, so all the blood can come very easily to the right heart, and it's called a proper preload, proper filling of the heart. Also, all the organs in the bodies which are vital are on the left side, which are not being pressured and not being non-functional. So this is the way we sleep. This is the way also we sleep for the whole night. You will see you'll have a wonderful sleep. Reasoning, proper venous return. Reasoning, right nostril breathing, suranari. Reasoning, organs of your internal abdomen. Morning when you get up, keep your one leg straight, put your hands slowly, and then you get up from the body, but don't get up suddenly, because your body needs some time to adjust. We call it your rule of 90 seconds. When you get up, you sit down for 30 seconds. You want your body's physiology to be back in normal. Suddenly if you get up, you will develop called a postural hypotension. Like blood pressure is falling down, there will be not enough perfusion in the head, and you will have multiple symptoms. You have a blackout spell, you will have a loss of balance, and it's not worth it at this time of our life. So sit down for 30 seconds. Then you stand up. Stand up and stay there for another 30 seconds. Let your whole cardiovascular system, let your whole body system to be in balance. Then walk slowly for another 30 seconds before you try to get into the normal activities of the body and mind. Rule of 90 seconds. Then when you sit down and you are sitting down all the way to the ground, you learn how to get up without a support. You talk about health. These are the signs of health. Able to stand on one foot with the eyes closed is your health. So from here, if you're on the ground, you get up, slowly you get up without a support. By the time you are able to do this, you will know that your health has returned, your Shastra Rokha has been maintained, Roger Chikitsa is done, all the disease being properly treated, and you are in a perfect balance and perfect union of your body, mind and spirit. Keep practicing this. You will see. Karo yog, raho nirog. Do yoga, stay healthy and disease-free. Yoga is the art of transformation from rogi, means person with disease, to nirogi, person with no disease and healthy to yogi, person enjoying a good quality living. Thank you for attending, and thank Facebook not to have any technical glitches. We'll be back again next week. Since we're at the beginning of the year, next week we'll start with our yoga therapy, how to start a pranayama session with your voluntary regulated breathing. Then the week after we'll do how to start a meditation session. Then we'll come back a proper disease-specific yoga therapies. Reductionist holism. We'll start with the musculoskeletal system, neck pain, shoulder pain, back pain, and we'll see which one people want. I think people will start with the back pain before the neck pain. Okay, thank you again for joining. We'll come back again next Saturday. Same time, same place. Any comments, question, please share with me. I'll be able to answer through Facebook.